Hi, I'm Dr. Gautier, and today we're going to talk about cancer and how to test for cancer with the HCG exam. Now, that stands for Human Chorionic Gonadotropin. And so what I want you to understand is this little test can let you know whether you're positive for active growing cancer in the body or not. So basically how this works is it's a test that gives you a score. And if you're above 50 IUs or international units, then you are considered positive for growing cancer, okay? And this is a very good test, and I've never seen it wrong. So you have to understand that I think this is a very safe test to do, okay? Now, this actually is a test at the Navarro Clinic, okay? So the Dr. Navarro is an MD oncologist, and his grandfather invented this test back in the 1940s. And so it's a very accurate test. And the guy's name now, the doctor, his grandson, is Efren Navarro, MD. So the good thing about this test is that if you're under 50, you're negative for growing cancer. If you're over 50, then you're growing cancer, okay? So I just want you to understand that this little test has never been wrong. We've never ever seen it wrong. And so what good is this test, and what do we normally see, and what are we looking for? So we're looking to see what the score is with the patient. So if the average score that we see with cancer patients is 51.5 to about 52.5. Okay, that's about the average with all the patients we've seen. In fact, I think 57 is the highest score I've ever seen. And that was a little 7-year-old girl with brain cancer that had the 57. But all the other cases, whether they're metastatic or not metastatic, 4-stage, 1st stage, it doesn't matter. Most of the scores are going to be in here. So what you're probably wondering is, well, then, I'm only, just 1.5 points away from being negative. But normally it's going to take you, the quickest I've ever seen anyone be able to reverse their cancer, okay, is about 12 months. And why I tell you this is because there are a lot of things you need to do to reverse your cancer. It's not like you just take a pill or do chemo or something like this and then it just disappears, okay? In fact, you should know about chemo. I should probably do another class in chemo to tell you about chemo, radiation, surgical procedures, things like that, but I don't want to get into that. So catch me on another video and I'll be sure to explain what's really going on behind the scenes. So again, 12 months is about the shortest amount of time I've ever seen anyone able to completely reverse their cancer. Now, we've seen many people say, yeah, the doctor said I'm cancer-free. And we have also noticed that those people had passed away just weeks afterwards. So you have to understand that if a doctor's telling you you're cancer-free, you're going to be pretty happy, right? But you're not going to be happy when a week or two down the line if you get sick and you die. So you have to understand that you should always be taking this test. And I have them do this test every 3 months. Okay? That's a good enough time to see how the scores go, whether it goes up or down. Now, what I want to warn you of in a test like this is if you see this test, let's say you end up with a score that's 52.5, okay? And then you see it elevate to, let's say, 53, okay? So that is about a 0.5 point increase. Now that can happen in the first maybe 3, 4 months, 5 months. It can happen because you're doing a lot of work, assuming you're doing the work that we teach in the cancer classes, okay? And if that's the case, and then, of course, it's normal to see a rise in the first few months. Now, if you're doing a lot of work, you may see that. Or sometimes it's just going to gradually go downward, okay? And so the reason why I tell you this is because patients have had this happen to them, and they're saying, oh my God, I'm getting worse. I'm going to die. And that's not true at all. So it's just because you're dumping a lot of toxins out of your blood, from the bloodstream, okay? And that's all it is. And so this HCG test, how we do it is we actually get, a little urine specimen cup, and you're going to need about 50 milliliters in that little urine cup. And as soon as you get that in the morning, it should be a specimen the first thing in the morning. Okay, so what we're going to do is we're going to put 50 milliliters of, this is urine, right? So this is your urine, and it's the first urine in the morning. So you collect in a specimen cup 50 milliliters, and then what you're going to do is you're going to put into a bowl 7 ounces of pure acetone, okay? And you're going to add to that 5 milliliters of ethyl alcohol, okay? Ethyl alcohol. And so you're going to mix these two together first in a clean bowl. And then you just put the 50 milliliters of urine, you add it into this bowl, and you stir it up and then put it in the refrigerator for a couple hours. And after a couple hours, you pull it out, you take a coffee filter, and just a regular coffee filter, and you'll put a different bowl under it, and you'll pour it through that coffee filter. Now that's how most people make it, but I'm gonna kind of clue you in on something. What we're really after is we're after the sediments that are in here that will form in that refrigerator. And the sediments will usually be down on the bottom. If you don't see sediments, that doesn't mean it's not there. It just means that it's stuck to the bottom and to the sides of the bowl where the liquid is, but you can't see it. It's kind of like transparent, so you really can't see it too well. But if you take a spoon or you take a knife and you start scraping away at the sides of the bowl and the bottom of the bowl, then you're going to notice a lot of gunk on it. And you don't need a whole lot, but you need enough to be able for the test. So whatever you can get, you're going to kind of take the stuff off the bowl and you're going to put it in this filter, right? Because in that filter is where you need to keep everything, because that's what we're going to send off to the lab, okay? And that lab is the Efren Navarro lab in the Philippines, okay? So, let's see, I think it's double out, huh? So in the Philippines, in Manila, is where you're going to send it, okay? So this is all online. You can find their information online, Efren Navarro, MD. And so again, so it's very simple. Just mix this together, and once you get all these together, it's in there for 2 hours or more in the refrigerator, and then you filter it out. Again, if you don't see any sediments in there, then you're going to have to scrape it. If you see them, just pour them through the filter, let it drip out, and then once it drips out, you put a paper towel down and you set it on there, and it'll just absorb the rest of all the fluid that's in there out of it. Once it dries, that means then you put it in a Ziploc. But before you put it in that Ziploc, you're going to write the patient's name, their age, their sex, male or female, and then you're also going to have the type of cancer, So if, breast cancer, prostate cancer, whatever it is, just write it there, and then your email, because they're going to have to send you the results. And it usually takes them 24 to 48 hours to get the results. So that's as simple as it is. So you would put it in there. Just the dry coffee filter, just folded one time like that and flattened down, and then you suck all the air out of this little Ziploc that you have it in. And so you want it to be flat. And then you send it off. And so you normally want to let them know that it's documents. I mean, that's usually the best way to send it, So I that's the way we do it, and so we want you to understand that it's simple to do. It's not very difficult at all. All you need to do is go out and buy some acetone and some ethyl alcohol, and then you just add your urine to those two things. You pour it through a coffee cup. That's it. Okay, and it's as easy as that. Now, they'll get back with you in about 24 to 48 hours. Of course, you're going to have to fly it over there. So you're going to have to either DHL it or whatever service that you use, whatever carrier, and you'll find that out. Now, I want to clue you in on some things that you're going to need to know about this test. Why would we do this test? Why don't we do the test in the hospitals? Okay, why aren't we sending for those tests? Because they're not as accurate as this one. This one shows up much sooner, this test, okay? And so it gives you a very good indication of where the patient's at, okay? And I've never seen it wrong, all right? So it's a test that I have found to be very, very accurate, okay? So some of the things that I've seen with this kind of test is I've seen people go down to reverse their cancer. Let's say if they were at 52.5, I've seen literally 0.5 of a reduction, okay? 0.5 of a reduction, or a half a point, which is pretty significant. Any 4.4, 0.5 is very significant for the first 3 months, for any time. So if you can keep this going, obviously you can see that in about a year, you could be under 50. And so it just depends how hard you work, what you're doing versus what you didn't do. Or maybe you think that you've done everything that you're supposed to do, like everything that we teach you. And say you were in a 30-day retreat with us, you would learn everything, or a virtual retreat with us. You would learn everything you need to know about what to do to reverse the cancer. Because there are no cures for cancer. I think you guys probably know that by now. There's not cures. You can't just say, here, I'm going to take this pill and the cancer's gone. That's a bunch of baloney, and it's not true, and it's very dangerous. If you're going to reverse your cancer, you need to reverse it. You don't take anything that I just think it would be crazy for you to believe that you're going to do something out there. It takes a lot of hard work, let me just say. And is it hard, really? Well, you can eat food, so you're gonna eat just better food. You're gonna make better choices. We teach you all those choices. You're going to make sure that you exclude a lot of things out of your diet. You're going to, you got to make sure that you're away from a lot of toxic materials, things like that. And so that's why we spend so much time in class work with a patient, so that they understand what they have to do and then what the pitfalls are, okay? So that's why this is a good test. Now, I'm going to tell you something. I had a patient not that long ago, and she came in at 51.8. That was her initial test. And then she went 3 months and she did another test. And she went down to 51 point, I think it's 3. I think it was 51.3. Okay, so she dropped about a half a point, right? Actually, a half a point. That's what she dropped in 3 months. Now, you know what happened after that? She spoke to somebody because somebody's uncle's cousin's grandma was listening to somebody tell her about this great thing for cancer. So she changed what she was doing with this wonderful deduction here, and she changed. And so for 6 months, okay, for 6 months, she did something different. I don't even know what it was. You know, she just told me she made changes, and the score at the end of that 6 months was 51.3. It was the same score. So theoretically, if you're at 51.8 for 3 months, and then 3 months later you come to 51.3, that's a beautiful deduction. And I would assume that she could have done another half a point in 3 more months and another half a point. So I would expect her to be down around maybe 50.3, which is basically almost virtually under 50, right? It's very close, it's extremely close. But it takes time. You know, this all takes time. So she made no deduction whatever on whatever she was doing. And that's why this score is good, because it helps you, because where are you doing all this work? You're doing it in your house, right? That's where you live, you know, that's where you're going to be doing all this, and you have to get good at it. But you also have to learn the do's and don'ts of cancer. And there are a lot of do's and don'ts, and a lot of things that you're going to need to learn that we definitely can't cover in this class, because it takes us about 30 days to teach the people. Okay? But I just want you to know, this is what I want you to be aware of, is that when you change your treatment, that doesn't mean it's going to work. And what I can say about this score, if it didn't move, is that you're not doing all the things that you need to do to make it continually to go down. Okay? And there's probably many things that are around you that are affecting your ability to get better. And that's really important, because your life depends on it. And so the people that think that they can just go do anything they want and that everything's going to be okay, and mysteriously the cancer's just going to reverse itself, is a fallacy, and it is not true. So don't believe anything like that, because I wouldn't want something like this, you know, to affect you, because you've wasted 6 months. And the thing about cancer is that you can really go downhill. You can go downhill very quick if you're not doing all the right things, or you're doing, you know, you're around a lot of toxic situations and things like this. So I want to encourage you to try to stay on to the things that are working and stay away from the things that aren't working. And so for that, I say this is a wonderful test. I've never seen anyone with cancer show up negative on this test. It's always been accurate. And they say it's about 4 years more accurate than any other test out there. And I don't think there's any natural or alternative cancer treatments that wouldn't be using this test. It's a very popular test. I think all the top gurus in the world that have all passed away, by the way, because they're very old. I think that all of them use this test, okay? And I would strongly suggest using it to help you out. Okay, so I hope that's been some help to you to understand that there are things that you can do on your own to try to see where you're at with the cancer. Okay, and so I don't want to get into biopsies right now, but I should probably come in with another test to show you some of the things that can really make your cancer go out of control. And so I'll probably have another video on that here real soon. I want to mention something, and this isn't just for people who have cancer, but it's also good for people who wonder if they have cancer or if they're positive for growing cancer. Because we want to know whether you're growing cancer in the body. Okay, that's very important, because if you are, that means that you're eventually going to be overwhelmed with cancer. And so this test would be wonderful, even if you don't think you have cancer, or if you're somewhat young. We see a lot of cancer now with the young people. I mean, I was telling you, this score right here was a 7-year-old brain cancer patient. You know, so it is very possible to get cancer at a younger age, especially now, with all the environmental things that are happening, and I'm sure you know what I mean. There's a lot of things happening out there that right now that are very carcinogenic. So, you know, that's just something that you want to keep in mind. So go ahead and take the test anyway to see where you're at, and if you're negative, then that's wonderful. And if not, then you know you've got work to do, and to bring that test down under 50. Okay? If you guys like this content, please like and subscribe. Thank you so much.